Hey everyone, it's Drew here, back with the IM3 booth at FFAS 2018. I'm joined by Dr. Yellin. Thanks for joining us.
Hey, good to be here.
How are you?
I'm great. How are you?
Good. I'm doing really well. Thanks for asking.
Sure.
How's the show going so far? I know it's day one, but
Yeah, no, it's always an event I look forward to going to. This is, I believe, my 18th or 19th year at FFAS.
Okay.
I missed 1 year, but short of that, it's been a consistent meeting I've enjoyed. I used to run the facial plastic surgery program at Emory from 1999 until 2011, and we hosted FFAS in Atlanta for about 5 years. So it's a meeting that is near and dear to my heart.
Awesome. Good stuff.
Yeah.
So tell me a little bit about why you like this meeting more than others. I know there's the live surgeries, which are really important.
Yeah, I mean, I wouldn't compare it one to another. Every meeting has its own vibe. But first of all, like most things, you tend to gravitate to places where you enjoy spending time. And the people in this meeting and the people who run it, particularly Phil Langston, have always been extremely welcoming. And that's really encouraging. And then also, the original intent of the meeting was as a way to train residents in academic programs. Mm-hmm. And I was really committed to teaching and to training, so I always felt that the mission of the meeting was important. But then with years, things evolve, and it's just become a good, solid meeting where you learn lots of little tricks. Surgery is all about increasing your bag of tricks. So if you can pick up one or two good little tips from your colleagues, which you always can,
Sure.
Just makes you a little bit better at what you do.
Cool.
It's also an opportunity for me to speak and share some of what I've learned and continue the passion that I have for teaching. After 2011, I did leave academics and go into private practice, and that has its own strengths. It also has some negatives, and that is I don't get to teach residents every day. So going to meetings and lecturing and listening and being part of panels just fulfills that part for me.
Awesome. So now you're able to give back a little bit to the community as well, right?
Yeah, I mean, it's just part of what surgeons do. It's part of what doctors do. Is
Sure.
We really feel, I think, a commitment to training the generation below us and, serving the community.
Yeah.
Isn't that really why we do it?
Awesome. Cool. So one of the things I noticed on the tracks here, there's for both the first non-surgical and surgical tracks, there's an emphasis on complications and talking about possible complications. I've noticed that not all shows are willing to talk about, hey, we've made mistakes, but how do you feel about, talk to me a little bit about how important it is that the doctors get up there and they're honest about, hey, I've made a mistake, don't make this mistake, versus being, hey, we're perfect, we never make mistakes.
Yeah. So, there's an old saying in surgery, which is if a doctor doesn't admit to mistakes, he's either a liar or he's not busy. So it comes with the territory. There's no way that you can operate day to day or even do non-surgical fillers day to day and not have issues. It's just part of the territory. And again, it's about understanding all the possibilities and hopefully no one practice sees all the complications, right?
Sure.
So hearing from your colleagues and learning about the rather rare complications and how they manage them, I think better prepares you to handle the very rare event and gives you more confidence. So, again, it's all about protecting the public, and the more you learn and the more you know, the better you are.
Sure. So you had several presentations for this show, right? You want to talk a little bit about those ones?
I do. So, I am currently a facial plastic surgeon in a very large dermatology practice, and it's a very unique opportunity for me personally. It was also a unique opportunity for the practice. So our practice is very robust. The dermatology side sees about 100,000 people a year, and we, of course, stay very busy. But the reason I bring that up is my practice has morphed. When I was a full-time academic at Emory, I certainly lean more on the surgical side, and whether it's demand from the public or the relationship I have with my dermatology colleagues, I've really blown out the non-surgical side of my practice, and I've found it to be a great complement to the surgery that I perform, and it's an easy entry point for many patients who may be apprehensive about surgery and worried about downtime and risk, etc. So I'm giving 4 talks. I'm giving 2 non-surgical talks. One about managing the lower lid and mid face, and that's really a melding of both surgery and non-surgery. It's a crossover lecture, and will lead later on into a panel discussion about when to go to the operating room for lower lid issues. And then the other non-surgical talk is 3-dimensional resculpting, basically really global reshaping of the face with non-surgical methods. And you're really only limited by your knowledge and artistic vision. So I'll tell you, I'm a much more focused observer of faces in terms of noticing every little nuance of asymmetry or disproportionate, relationship, and we can often very specifically tweak that and make faces subtly more beautiful in a very natural way. On the surgical side,
we'll have to talk after this.
yeah. Well, I'm not a miracle worker. But on the surgical side, I'm talking about again, one of the standard procedures that is well known to all those in this meeting, which is a SMAS facelift, and whether it provides a result that we're still proud of. And for me, it's a resounding yes. I'm very proud of the outcomes. The patients are very happy. It's got very low complication rates, and all in all, I think provides a really beautiful enhancement to an aging face. And the other procedure is a procedure that I do very occasionally when you look at other procedures that I do, but it's a great procedure to have in your back pocket. And it's a direct neck lift. We're actually directly removing laxity, and it's really appropriate for the older male patient or the older female patient who doesn't want a facelift, maybe can't have a facelift either due to medical conditions or otherwise. So these are the talks that I'll be focusing on here.
Beautiful. So last question, where do you see, it seems like, like you said at Emory, maybe you were more surgical. Now it's at the dermatology practice, you're getting more non-invasive. Where is that obviously it's trending, but where in the 5 to 10 years from now, is it going to be, 90% non-surgical for a lot of these?
Yeah, I don't know if that's the case. I mean, first of all, things don't happen that quickly in medicine. It's really a slow evolution. I would equate it to a glacial movement, right?
Okay.
Really slow and
Sure.
and consistent, but I don't think surgery is going away anytime soon. I think our understanding of facial anatomy and surgical options are actually increasing. So there'll always be patients who are better served with surgery, those who are better served with non-surgical interventions. I think we're really entering into the biologics. We're going to really take advantage of the body's own healing mechanisms, hopefully understand better ways to stimulate elastin, better ways to reestablish a youthful glow to the face. Stem cell technology is interesting. There's certainly things that we know about, but what's really fun is the things we don't know about yet, right?
Sure.
So you'll just have to stick around and interview me in 10 years.
Yeah, cool. Well, I look forward to that.
Thanks.
Awesome. Well, thanks, Dr. Yellin. I appreciate you joining us. It was a great
Thanks.
conversation.
Appreciate
Have a good
it.
show.
You too.